It is challenging to explain depression to someone who has never experienced it. The only people who genuinely understand depression are those who have personally dealt with it. People manage their depression in different ways. Some people may self-medicate with drugs. Some may turn to food, while others may withdraw or isolate themselves. However, some people experience high-functioning depression, and it is simpler to conceal this milder type of depression from others. Although the appearance of high-functioning depression varies from person to person, some universally shared characteristics exist. Before moving further, please take a moment to subscribe to this channel. What is depression? Depressive disorder is an alarming mental health condition that affects 21 million Americans annually. Depression is not to be confused with the depressed or lethargic sensations that follow a challenging incident in life. These brief periods of melancholy are intimately linked to a particularly unpleasant experience, such as a breakup, divorce, job loss, or the death of a loved one. Many people can move past such experiences without the assistance of a professional. On the other hand, a combination of symptoms that last more than 2 weeks characterizes clinical depression. Depression symptoms include persistent melancholy, pessimism, or despair, loss of interest in once enjoyed pastimes or activities, alterations in hunger that result in abrupt weight gain or loss, hypersomnia or insomnia, being agitated or lethargic, tiredness, strong emotions of humiliation, worthlessness or remorse, difficulty focusing or making decisions, suicidal or fatal thoughts. The etiology of depression is not always identified because it is a complicated and frequently enigmatic mental health condition. A family history of depression, specific medical problems or drug side effects, an imbalance in brain chemistry, traumatic life events, and substance use disorders are some of the probable risk factors that experts have found. These descriptions are common to major depressive disorder, whether acute or chronic. Many people asked what high-functioning depression is when it was reported that Chesley Christ, a former Miss USA, entertainment news correspondent for Extra, and lawyer, had battled high-functioning depression for an extended period before her suicide. And how might someone with that level of achievement encounter it? Although high-functioning depression is not an official clinical diagnosis, it is commonly used to describe people whose depression is so well hidden that it does not affect their day-to-day functioning. For instance, they might be getting along well with friends, performing well at work, and not showing signs of despair. But on the inside, they might be having difficulties. Long-standing misconceptions about depression link real depression to functional impairment. You're depressed all the time, you can't seem to get out of bed, and you lack the motivation to perform effectively at work. The stereotypes of high-functioning depression are untrue. Mental health professions argue that the term high-functioning misleadingly suggests that since an individual can function, there is no apparent need for intervention. In the medical community, persistent depressive disorder or dysthymia are terms used to describe high-functioning depression. According to Johns Hopkins Medicine, it is a longer-lasting but milder form of depression that occasionally includes episodes of severe depression. Experts at the Mayo Clinic note that while dysthymia is typically not as severe as major depression, people with it can have many of the same symptoms, ranging from mild to severe at different times. These signs could consist of shunning social interactions, appetite shifts, increase or decrease, inability to focus or make decisions, overwhelming rage or irritation, exhaustion and poor vitality, having no hope, empty, depressed, or down, regrets or concerns regarding the past, low self-esteem, decreased efficacy, activity, or production, self-criticism or a sense of inadequacy in particular areas, problems with sleep. Dysthymia differs from major depressive disorder in that its symptoms are more situation-specific, so high-functioning depression can be challenging to diagnose as it doesn't cause the same outward symptoms as major depressive disorder. For example, a person suffering from dysthymia can attend work or school but act more subdued than usual. Alternatively, someone might appear normal in social situations but be underperforming at work. In addition, 5 of the symptoms mentioned above must be present for at least 2 weeks for someone to be diagnosed with MDD. A person must exhibit at least 2 symptoms mentioned earlier for over 2 years to be diagnosed with persistent depressive disorder. Those suffering from high-functioning depression may believe they are not unwell enough to seek help. However, nothing could be further from reality, as depression still lowers the quality of life, even in high-functioning cases. Remember that high functioning does not mean fully functioning. Even if most days they can complete most chores, people with dysthymia nonetheless feel some degree of disability. Just because you compare your depression with severe cases or stereotyped symptoms that don't apply to you doesn't imply you wouldn't benefit from or be eligible for professional assistance. And early intervention is crucial, just like in the case of physical disorders. If depressive symptoms are not treated, they can hinder functioning, result in major depressive disorder, or have other consequences like substance abuse, chronic pain, and suicidal thoughts or actions. There is no limit on the degree of symptoms for which you can and should seek assistance. Although dysthymia may not be as severe as major depression, it is very curable. When there are readily available effective treatments, there is no reason why anyone should live with a constant low mood. The first thing to do is to consult with your primary care physician or another healthcare professional if you encounter any of the symptoms listed above. According to the Mayo Clinic, talk therapy and occasionally medication are used in tandem to treat dysthymia. Those with dysthymia who receive cognitive behavioral therapy, one of the most popular forms of therapy for depression, learn how to replace negative thoughts and behavior patterns with constructive ones. Speaking with a therapist can help manage stress, and antidepressant drugs may be considered if depression presents with physical symptoms, such as changes in food or sleep patterns. Another crucial strategy for managing dysthymia is self-care. Changes in lifestyle to think about are observing regular sleep and wake-up hours each day, keeping a journal, practicing meditation, or creating art, arranging your day to include physical exercise, eating a diet high in fruits and vegetables to nourish your body, notifying loved ones about your struggles and asking for their support. If you wish to help a friend, family member, or coworker who has dysthymia, practice active listening. They could simply need someone to listen to them and affirm their experiences. They might not want or require answers. Therefore, ask them, "What can I do to support you?" rather than trying to provide a fix. Stretcher says, help cultivate hope where they may be experiencing hopelessness, but refrain from saying things like, think positive, or listing reasons why a person shouldn't be depressed to someone who is depressed. Recognize that there will be highs and lows, and keep in touch even if they seem distant. Let them know you're thinking of them and are available for a conversation at any time. That brings us to the end of today's video. Kindly give your valuable response in our comment section below. And don't forget to subscribe to our YouTube channel for more informative videos.